Hello everyone. Today I'll be talking about one of the most acceptable bariatric surgery for weight reduction, that is Roux-en-y gatrojejunostomy. As you can see, this is the stomach and the intestine of an obese patient who needs weight loss. So there are two means of weight loss by the surgery. One is the restrictive weight loss and one is due to malabsorption. The restrictive weight loss is due to the decrease in size of the gastric cavity, and the malabsorption is due to the formation of a roux limb where there is decrease in the common pathway for the digestive juices and the food. So there is malabsorption, and as this mechanism is mediated by the roux limb, the greater the length of the roux limb, the more weight loss the patient goes through, as there is more malabsorption. So what happens in this surgery? The jejunum is divided into 15 to 40 centimeter from the ligament of Treves, and a jejunal anastomosis is performed to create a 75 to 150 centimeter roux limb, which is then anastomosed to the newly created gastric pouch. This results in ingested food bypassing the excluded stomach, the entire duodenum, and the proximal jejunum. As you can see in this image, the stomach, the fundus of the below the fundus of the stomach, the staple has been fired, and the stomach is bypassed. So this is a gastric pouch which has been made for this surgery. So the food storing capacity of the stomach has reduced. Then we do two procedures, or we can say two anastomosis. One is gatrojejunostomy and one is jejunojejunostomy. In gatrojejunostomy, we take the jejunum and anastomose it with the gastric pouch we have made. And in the second procedure, that is jejunojejunostomy, we anastomose the two parts of the jejunum together. So what happens? The restrictive procedure is that the decrease in capacity of the gastric cavity. Now what is the obstructive procedure? Malabsorptive procedure. The malabsorptive procedure is that the digestive juice comes through the duodenum and the jejunum from the gallbladder, and also the succus centricus, and the food comes from the um, limb we have lifted and connected it with the gastric pouch. So what happens? There is less common pathway for mixing of the two components, that is the gastric juices and the food. So the higher length of the roux limb, that is the higher length of the jejunum used in the roux limb, the more amount of malabsorption and the less time and the less part the food and the digestive juice spend with each other. So what is the length of the roux limb? The common length of the roux limb is from 75 centimeter. It can range from 75 centimeter to 150 centimeter. For slim patients, like relatively slim patients, the roux limb length is 75 centimeter to 100 centimeter, and for obese patients, it is 150 centimeter to sometimes 200 centimeter also. Thank you.